Hello, my name is Poran. I want to talk about sexual abuse today. I am a registered clinical counselor and clinical supervisor with a background of social work. And I have worked a long time with survivors of sexual abuse. That's why I think that this is a very important topic and subject, and our communities deserve better in terms of understanding how to handle the concept of sexual abuse and how to help the survivors of sexual abuse. And we know that sexual abuse happens everywhere in all communities. It's not about gender. It's not about race. It's not about culture. It's about the challenge of some people who are the abusers or predators. They decide to kind of take action because they need to show up how they are in control or whatever. The concept of sexual abuse creates a huge, deep level, multi-layered level of pain and suffering for the survivors. If this is a childhood sexual abuse, usually the person will be impacted during entire life. I mean, even if it's an adult life, child sexual abuse, of course. However, for people who have been sexually abused as children and they have never managed to disclose the situation or seek help, the secret that is eating them up alive, it's hard to manage at times. And also the idea that it has been their fault, I mean, because they usually, the person who is the abuser, telling the victim that it is your fault, you have created the situation like this. And it's not true. It's never ever the survivor or the victim's fault. And the person has learned to kind of internalize the pain and suffering and always thinking that I have to be ashamed and I cannot talk about it because no one is going to understand me. And yes, it is hard to understand. However, there are expert help, hopefully, and the person needs to understand that since it has not been their fault, therefore they can deal with the situation better. The psychological pain and suffering as a result of sexual abuse lead the person at times to destructive behaviors, the psychosomatic pain, the loss of community, loss of self, and lack of self-esteem, lack of feeling that the person is valued or being can be believed or trusted, and their sense of that someone has betrayed them. Yes, that's true. That's a betrayal. People who are supposed to take care of us, if they abuse us, then what else can we think about? And especially in many multicultural communities, this concept is being silenced, and usually the survivor is not only dealing with the internalized pain and suffering, but also with the criticism of others that why you were there, why you kind of reached out to this person, and all those questions. Therefore, it's very important to know that it was never ever that person's fault, and sexual abuse is a very huge, multi-layered dilemma that needs to be explored and talked about. And in terms of signs and symptoms that the person with sexual abuse experiences is going through is a huge amount of anger at times, especially for male. Anger, agitation, sleeplessness, loss of trust, and always feeling or fearing that someone is going to hurt them, hypervigilance, and lack of concentration, lack of ability to focus, and losing jobs, and as adult, not being able to have a steady job or relationship or commitment. These are all the challenges because the mind is kind of disturbed in terms of how the person needs to focus on the self, and self-development, self-compassion doesn't exist for the person because the person has been only focusing on the challenges, not at the challenges. However, at times, many people learn very early on to kind of ignore those emotional conflicts with the self because of what? Because they want to survive, and they ignoring and avoiding the feeling is a very understandable coping strategies. However, the person cannot ignore or avoid the emotions for a longer time. At some point down the road, the person is going to feel that, yes, something happened to me. And if it's hard for them to kind of face the reality, it's going to be unbearable at times. That's why we need to pay extra attention. The suicide ideation and the suicide for survivors of sexual abuse is a serious threat, unfortunately, and also development of substance use issues and unhealthy coping strategies and interpersonal conflicts. So these are all the problems we need to focus on. And what can we do is if we see someone or someone disclose to us that they have been sexually abused, first of all, perhaps referring them to a psychiatrist, psychologist, counselors, mental health practitioners. If one person doesn't listen, let's go to the next, because in many communities, I know that the concept of sexual abuse, especially for male, is not being properly understood. Unfortunately, that's the truth. And we think that sexual abuse happens only to female. No, that's not true. Sexual abuse happens to both male and female, and it's not about the gender anymore. It's about the something else. And let's focus on the psychological pain and trauma, and the need for trauma treatment, the need for medical treatment, the need for psychotherapy, the need for self-development, the need for having a community around who understand and do not blame the person further, because the person is blaming themselves enough, and to the degree that they at times it becomes unbearable. That's why it's important to kind of explore this topic in your communities, wherever in this world you are, and live and work. If you are a mental health practitioner, if you are uh, a person, a family member of someone who has been sexually abused, know that it's very challenging. You cannot tell the person to forget about it, or let's go of it, or move over it, or don't think about it, because these advices doesn't work, and the person usually is in a lot of pain and suffering in themselves. So that's why listening to that type of advices make them feel even worse. So that's why it's important to have proper expert support and treatment. Sexual abuse is a society challenge, is not an individual challenge, and therefore all societies, communities, they need to come up with proper treatment plans and support and counseling and education and mental health programs that can help the person to understand what they have gone through has been horrible. However, they can survive, and they are survivor, and they can develop new skills in terms of dealing with the hardcore emotions. I think the best is for the person to learn how to differentiate between the child that was abused and the adult that is there now, and how they can kind of heal themselves through proper treatment, however, to kind of be able to manage through the emotion and integrate themselves better with the reality, the horrible reality that sexual abuse is, that's for sure. So I'm hoping that this discussion can be explored further, and I would be happy to receive your feedbacks and how we can talk more about this, because I believe many people are suffering uh, in silence, right? And this is a society problem that is very silent, and usually there is not much people can do at times in many communities, maybe if they are not being understood, and usually that's the case. The survivor of sexual abuse, if it's a child, usually they try to reach out to someone to tell them and to disclose. However, if they are not being understood, and no one listens to them, or they are trying to do, they are being silenced and uh, told that this is wrong, and they just imagine the problem, then imagine what happens. No one imagines, no one imagines to be sexually abused, and the concept is wrong if we think that their children are being kind of imaginative. This is what's happening in my community. I know that parents, they're trying to kind of ignore the problem by thinking that no, the child perhaps is making a story to get attention or things like that. That's not true. Believe people if they are saying something and that happened to them, and listen carefully, and especially if it's a child, if try to get proper help, because otherwise, unfortunately, long term, lifetime impact of sexual abuse causes a lot of disturbances, psychological, mental disturbances in person's life, that at times it's hard to kind of deal with everything at once. However, still, whatever is the case, sexual abuse is a horrible trauma. It stops the person from moving on from the situation. The person is constantly in that stage of shock, and at times, because they cannot kind of stay in that stage of shock, they try to deny it, or they try to ignore the problem, or they try to kind of use different coping skills in terms of, let's say, alcohol, substances, gambling, what else, unhealthy behaviors, to kind of forget about the uh, act, what happened to them. However, as I mentioned before, no one can forget things, at least not for a long time. So that this is my message, and I hope it goes to those in need, and we can further talk more. I would be happy, and I appreciate if you can share this video with others, and subscribe to my channel, because I'm going to talk about mental health. That's all I know. Take care. Bye bye.